but whether or not I'll actually have students at this optional meeting. Oh, 2 people. I'll take it. Hi, Lauren. Lovely, lovely. Good.
Melissa said go ahead and put in some zeros.
Melissa just said put in zeros.
So, put in some zeros so the kids know what their true grade is.
Great.
Yeah, right.
Copy that.
I'm emailing them today and warning them it's going to happen next week.
Oh, yeah.
So this is your chance to get it together.
And I can understand from her point of view why she doesn't want this, because she's gonna get the emails, because no one actually comes to the teacher first. They go straight to the top. But you know what? Sorry, buddy. Until someone starts to give us a break too. Like, I'm not giving these kids a break. Like, until someone says, hey, you can take Fridays off, don't work as hard, here's some free internet, I don't know, pay my phone bill. Yeah. Oh, I forgot the kids can hear me. Hi, friends. I kind of had a feeling. Wait, can you guys hear me? Anyone? No one wants to use their face today.
Yeah.
Oh, you can. Good. Hi, Haley. Everyone's hiding. I mean, that's okay, but I will have to take like a little mini roll just to make sure you are who you say you are. Amen, are you here? Amen?
Yeah.
Okay, good. Amelia?
Yeah, this is me.
Moira? I know it's always Moira because you use the same background every time. I'm assuming no one else would be able to do that. Awesome. Makana?
Yeah, I'm here.
Great. Well, we have a nice little small group, which is great. And to be honest, pretty much the people I expected would take advantage of this, which is great. And our guest speaker is waiting in the waiting room. So I just wanted to give you a quick little, set of etiquette before we got started with our guest speaker. Hopefully some more people will join us soon. Actually, I'm going to send out a blast right now to see if that helps. Join us with our guest speaker. She's on our Zoom right now. Cool. Okay. Well, my goal was 7 to 20 people, and there are exactly 7 of you. So we're gonna move forward, and I just wanted to make sure that we're obviously being super polite to our guest speaker, ask questions thoughtfully. She is absolutely willing to answer any questions you have, which is great. But at the same time, obviously be respectful when you're asking the questions. I think that's it. And I would like to welcome our guest speaker. Here she comes. Drum roll, please. It's Miss McNeela. Hooray, here she comes. Miss McNeela, can you hear me? You can come off mute and we would love to hear your beautiful voice. And actually, everybody, since we're a small group right now, if you want to come off mute, you are more than welcome to. Or you can just wait for when you have a question. But I would like to introduce our guest speaker today. This is Miss McNeela, and she is here to talk to us about her journey with renal failure. So this may be new information for you. Not sure if any of you have had Miss McNeela before. Miss McNeela, you can see everybody's name on the screen. I don't think anyone, yep, we've got Marley Johnson in case you were looking for last name there, and Amelia Thompson. So anyway, I would love to turn it over to you. We are just interested to hear about your journey, about any insight you have into having this disorder, and maybe what your true diagnosis is and prognosis. And then if you don't mind us asking you some questions later on, that would be great.
Sure, you can ask anything you want. Yeah, I'm happy to be with you this morning. Excuse me, this is the first time I'm actually like fully talking about it. Sorry.
No, this is awesome and hard, and I'm sure especially hard because as teachers, when we're in front of our class, like maybe they don't realize it, but it's super easy to put up a big old wall and play a role almost in front of your class, and any inhibitions or any feelings of anxiety and stuff. Teachers are really good at masking that. When you're sitting at home in the comfort of your own home on your couch and there's not actually people around, like there's no eyes to build the wall for you. So I totally get it. Take your time, and if anything's too much, then that's okay.
Okay, yeah. I mean that's the truth of it, is that I don't talk about it with my students at all. I don't talk about it with most people actually. And so I've held back for several years, like wanting to disclose this to my students, just because I was always dabbling with the appropriateness of the subject, and I didn't want really to evoke pity. And for the most part, I just want to go in, put on the smile, and teach my classes with vigor and gusto. But it has been a challenge for sure. I think 2 years ago was the closest I ever got to talking to my students about it, because I was so sick. I was sick for like almost 3 months straight because my immunity is so compromised that I just kind of had to just tell them a little bit about it. But I think it was like a 1-minute conversation. But in any event, my official diagnosis is polycystic kidney disease, which means on both kidneys, I have large clusters of cysts that have greatly reduced the function of my kidneys. And I know that when it comes to kidney disease, you say polycystic, it doesn't really sound that threatening, but the fact of the matter is both kidneys are completely covered in cysts that are almost like strangling my kidneys, which means they're at the final stage of kidney function. So I'm in stage 4 of my disease, which is the final stage. And so I'm technically in what's considered the renal failure category. And I was diagnosed about 10 years ago when I was in my early 30s. And I had to go in to get a routine physical for my job as a teacher. And my blood pressure was really high. And my general practitioner was worried, and so he started taking my blood pressure like 3 times, 4 times during this visit. And he said, I'm super concerned because it's actually at the level where you should be hospitalized. He said the numbers are really off the charts, and he said for someone your age and you have a fairly healthy diet, it doesn't make sense why your numbers are reading like this. So that began a battery of tests, which all came back very much inconclusive. They didn't know what was causing these really high blood pressure results until finally, like on a whim, he said, you know what, let's just test your kidneys. So sure enough, at that point, it's probably like a month and a half into the process, they diagnosed me with this disease. There's no history in my family of this disease. So with polycystic kidney disease, more than 95% of the cases are genetic. And then there's this small anomalous fraction that's not genetic, and that's what I fall into. So it's even more of a bizarre situation for me, because it's so advanced at such a young age, because usually renal failure affects people who are significantly older than me. So the fact that I'm where I am now often sort of leaves my doctors fairly quizzical. So in the process of when I was having this battery of tests done in my early 30s, my doctor, general practitioner, put me on medication to deal with my blood pressure, because even if he didn't know necessarily what the cause of the high blood pressure was at that point, he wanted to try and regulate it. So unfortunately, with this first medication, it was a beta blocker, so it wound up adding in sort of the weight gain process. And so next thing I knew, I was like super choochy, and that was really messing with my mind. And then, I was deeply troubled by it. We changed the medication. He told me to go to an endocrinologist as well as a nephrologist once we had a diagnosis. And then the endocrinologist made me meet with a nutritionist. And so I did that for a solid year, and I was able to drop 30 pounds within about 3.5 months, because I was limiting my calorie intake to about 1,200 calories, and I was exercising a lot. But that was important too, to naturally lower my blood pressure, because the more active you are and the more you keep your weight down, then the better your blood pressure theoretically should be. And so in addition to the kidney disease, weight has always been an issue for me in the last decade. It fluctuates quite a bit. But what we found is even when I'm at my healthiest and I'm at a really reasonable weight, my blood pressure is still exceedingly high. So for a while, my blood pressure meds, they worked, but is Patrice there?
Yeah, Patrice is barking for food right now. Do you see her?
I have Patrice with me too.
Oh, she's like, time for snacks, it's lunchtime. Sorry, guys.
That's the problem when you feed the squirrel.
I know. You gotta wait, kid. Sorry.
Okay. So anyway, my meds are not really working for my blood pressure anymore. So I'm in a high hypertension category, as well as having polycystic kidney disease. And so there have been times when I've gone into my nephrologist where my top number is in the 170s and my bottom number is in around 112, 115, which is really scary. And then normally he tries to talk me through some breathing exercises, because he's deeply concerned when my numbers reach that level. But on a good day, my top number is about 140. And my bottom number, if it's below 100, I'm at least happy. It's still high, but I've learned to deal with it and learn not to get super anxious when I see how high the numbers are.
I'm going to pause you just really quick, Ms. McNeila, just because I'm sure you guys are all hearing so many great things already that you can recognize as pertaining to what we've learned in MI. First of all, I kind of wanted to backtrack to when Ms. McNeila was talking about how her particular type of renal failure is acquired. And she mentioned that many of the cases of polycystic kidney failure is due to a genetic defect. And then a smaller portion of those cases are spontaneous, meaning they just happen to happen in someone because of a mutation, a point mutation at the time, like when they're born, or and maybe Ms. McNeila, you can shine some light on this. Maybe there are some environmental factors that could have played into this. Do you happen to know?
There might have been, but I've never had it. My nephrologist, and I've had 3 in the last decade, none of them have ever been able to give me a concrete answer about that.
Sure.
And for the longest time, there wasn't much fluctuation in my disease, but since I moved to California, there's been an enormous rapid decline in my.
Interesting. Yeah, so something that we can maybe do a little digging on as we move into our next activity when we're looking specifically at polycystic renal failure. I also wanted to just kind of shine light on the fact that Ms. McNeila has talked about all the different people that she's had to see in order to take her through her diagnosis and prognosis and treatment of her condition. that it's not necessarily one nephrologist and that's it. That's the only person she's seeing. She's seeing lots of, like she mentioned, nutritionist, a dietitian, and all the different technicians along the way, regular physician, obviously the kidney specialist. So just something to keep in mind again as we move into our next activity, that this is not a one and done. And we talked about this in our activity last week when we examined different careers in healthcare, that in order to treat anything, it's not just one person. It's many people in the healthcare system that are involved in treating one patient for one thing. And then lastly, I just wanted to make sure that you guys are thinking a little bit about, when you have a renal disorder, whether it's end-stage renal failure or just the beginnings of a renal disorder, that one of the first big signs and symptoms is blood pressure fluctuation without any underlying cause. So Miss McNeila wasn't, out eating cheeseburgers day in and day out and slugging on the couch. That would be reason enough for her to have high blood pressure. But she's young, she's healthy, she's eating appropriately, and this was one sign that was like, wait a second, your blood pressure should not be this high. And she mentioned that it's been as high as 170 over 115, and hopefully you realize that those are some pretty high numbers and something to be mindful of. Yes, is high blood pressure an effect of the renal disease? Yes, but then that in turn puts stresses on other body systems, right? Because obviously your blood pressure and your blood travels throughout your entire body. So high blood pressure can be detrimental to everything in your body, especially cardiovascularly. So just some things to keep in mind in case you're jotting down some thoughts and ideas for your next activity. But also don't stress too much if you haven't written anything down, because of course this is recording and you can always refer back to this later when you're building your activity. Okay, I'm so sorry to interrupt you, Ms. McNeila. Please continue.
It's totally fine. It's like, as you're saying it, and the other worry I have to deal with is related to my heart, right? And so I'm at like this very high risk of stroke. And it's just when you say it all out loud, sometimes you're like,
Right.
What life am I living right now?
It's crazy.
Yeah.
Oh, sorry, one thing I was just going to say, guys, that if you have questions that are like popping up and they're burning and we're not pausing for you, please feel free to drop questions in the chat over to the side, and I'll let Ms. McNeila know when some questions pop up that maybe we should pause for. Otherwise, she can come back to those towards the end. Or feel free, if you just I gotta know right now, unmute yourself and jump in. All right, keep going.
So I think one of the questions that you had posed when we were emailing was like, what does it feel like to have kidney disease, and what does it feel like when you're in renal failure? And most people would not know that I'm sick, right? As I said when I started out this discussion, is I don't really talk about it too much. I have to really trust the person to even divulge this information. But one of the issues with this this illness or this disability, if you want to look at it that way, is it's a silent illness, and most people do not know that I am as sick as I am. But one of the major side effects with polycystic kidney disease is intense fatigue, and it's the type of exhaustion that you feel as though you've been hit by a truck. Every single muscle in your body hurts. And there are most mornings where I feel like I cannot get up and get out of bed, but I find the strength to do it. And there are times when it is inordinately difficult to teach, but I do it. And like you said, you put on a mask and I put a huge smile on my face and I find the energy somewhere inside of me. But the entire time my body feels like it's in a war with me. And sometimes come the end of the day, when 3:30 hits, I just have thoughts of my bed. So it has definitely been a struggle, especially as my my function has declined a great deal in the last couple of years to find that energy. And there were times when I called in sick, it was because I couldn't move. Like I just didn't have the energy to go in that day. My fatigue is intensified to the point where I have at least one day a week where I can't move. I can't get out of bed. With kidney disease, because it prevents the normal functioning and flow of getting rid of the toxins in your body, you chronically feel like there's just a residual negativity inside of you. And then dehydration is a huge issue that I face as well. So, and then, like, oddly enough, one of the medications that I went on in this last year, I actually have it here. It's called GnRRQ. This was only approved by the FDA with like in the last year. So I was one of the very first group of patients to try it. But oddly enough, the major side effect of the medication is hyperintensified dehydration, which seems like it's counterproductive to kidney disease because you want to drink as much water as possible when you have my disease. So then this medication forced me to drink like exponentially larger amounts of water than my body was even used to. So on average, I was drinking over about 120 ounces a day, and I was still feeling dehydrated. So those of you who, who I've taught, you've seen me with either my big water flask or my big cup, and I'm constantly drinking and constantly refilling it because my body feels like it's in a state of depletion all the time. And the dehydration is so extreme that I was waking up at least, I would say, about 6 times a night because my body would need to have water. And so for the last year, that really interrupted my already pretty disturbed sleep cycle.
Right.
So then that, on top of the fatigue that I normally have from the disease, added an even larger challenge. And the idea was that the influx of drinking all of this water was going to help stimulate your kidney function, and it wasn't going to necessarily cure you because there is no cure. It was at least going to slow the progression of the disease. Now, it did not work for me at all, and in fact, my kidney function dropped at an even faster rate. So currently, my kidneys are functioning at 14%, which I'm still sort of in disbelief that this is my reality. And I most likely am going to have to start dialysis within probably the next month. Now, of course, COVID and everything that's happened in the healthcare system has put sort of a stagnation to my process. I have a fear of going to the lab to get my blood work done because I have to get my blood work done every month. And this is what a blood work request looks like for me. It's 2 pages long. And my fear is not to receive my results. The fear right now is to go to the lab where there are other sick people and potentially exposing myself to the virus. And so I'm one of the high risk people that needs to limit my exposure, right, in social distancing as much as possible. So this is what sort of made me a fraidy cat of going to get my blood work done, but I need to do it.
Yeah, there's so many different, too, you guys should be noting as well, like what she's talking about, all these different feedback loops that are occurring within her system where, the polycystic kidneys are causing high blood pressure is causing anxiety causes high blood pressure causes kidney failure. I mean it's just all these things that keep going back in a circle and like it's one thing that has caused an effect to the other, that there's no good negative stop to it. So unfortunately, yeah, I can understand why, like, if one thing's out of control, everything else spins out of control.
Yeah, it does. And then with my, so it was funny the way the timing was with everything, because my last nephrology appointment was March 12th, and then our last day of school was March 13th.
Yeah.
And I actually took off on March 13th because I had just received my results from my nephrologist. I knew they were going to be quite negative. I knew I wasn't going to be in the proper headspace to go into school the next day. So that's why I took off. And then, of course, that was the last opportunity that I would have had to see my little sweeties. So it's been like a very strange, dynamic, the way that everything is fallen into place. But when I went to see my nephrologist, he was so concerned about my numbers that he wanted me to go to Cedars-Sinai to start the immediate approval process for kidney transplant. And so the timing of everything, when I contacted Cedars-Sinai, they're not taking any information related to this because it wasn't a priority. And, that's also difficult to hear, is that, your well-being and the potential that you're going to face a complete organ shutdown and then need hospitalization because of it, that's not a priority given the current state of health right now. Which then we can dive into the entire other conversation about the transplant process, which presents a whole bunch of other issues, and some of them are psychological and emotional for me. But I don't know if this is a good place to pause if they have any specific questions that they want to ask.
Yeah. So there's one in the chat from Franklin. She said,
Morning, Frank.
Are kidney transplants helpful in helping improve your condition?
Yeah, they are. Hi, oh my goodness, hello, good morning. They are definitely. The problem with the kidney transplants is that if you don't have a living donor, right, somebody hopefully that is your relative, that's a match, that's willing to donate, then you have to go into the donor bank, and that's based on seniority of dialysis. So I really theoretically, once I start dialysis, I probably would not be in the lineup for transplant for another 10 years, which means my life would be altered in such a state that I can't even envision it right now, that I would potentially have to go a decade on daily dialysis treatments, which is, that's a whole other conversation that we can have. Now, if I were to get a kidney transplant, this will solve some issues, but it is not permanent. And my doctor told me because of my age, I will probably have to have a second transplant in my lifetime. So it's, it's a lot to think about.
Which is common, just so you guys know, that any kind of transplant that happens, some organs more so than with others, but that they're not a lifetime guarantee. They will expire eventually because they're not yours. And even if you can get a really close match, super close, like an identical twin, it's still not going to be your body in your body. So there's only a certain amount of time before your body realizes, hey, wait a second, you've pulled one over on me too long, get this thing out of here, and your body just starts to reject that organ. And the function just isn't as strong as it could be if it was yours and your body knew how to rejuvenate it, heal it in the way it does its normal organs. So yeah, unfortunately, kidneys can, like Ms. McNeil is saying, can go a little bit longer, 10, 15, 20 years even sometimes. But like when you're talking about like heart transplants, most people have a heart transplant every 5 to 10 years, depending on where the heart came from. So, and a lot of times, especially because we have one heart in our body, and you can't donate that unless you have expired. So when it comes to heart transplants, you're only getting a transplant from someone that is deceased. And because of that, that organ has not been, alive, so to speak, for some amount of time. Maybe super short, maybe you've got some surgeons or an ECMO machine. And the technology for transplants is so cool. And we're going to get into that in the next couple weeks. But still, there's a time period where that organ has been shut off, and therefore, it's just harder to get it started back up to get into the body. Whereas living donors are much more ideal. So in that case, that is the good news. However, as Ms. McNeil is alluding to, transplants are hard to come, or kidney transplants are hard to come by because unfortunately a lot of people need them. So the donor lists are extremely long. The process is extremely tedious, and we will be going through that as well in class, and how you get on the list, who can be on the list, who is above who on the list. Is it just about time? No, unfortunately, it's not just about time, and you can slowly move up. Someone can bump you in line, based on a multitude of factors, location, age, and, the type of disease. So there's all kinds of things that can get you bumped out of line and pushed back, pushed back, and pushed back. So especially with living donors, when you have a match, within your family, and you can just say, hey, this person wants to donate their kidney to me and me only today, that's a much more feasible way to get a kidney fast. But thanks for your question, Franklin. That was great. Anyone else have any questions right now? We have about 15 more minutes, so I just want to make sure that we respect Ms. McNeela's time. I want to make sure we hear all of her story, but at the same time, I want to hear from you guys too if you have questions. Nothing right now, nothing burning. You can always throw it in the chat or just unmute yourself and jump in. Okay.
So
one just popped up, Ms.
Okay.
McNeela. Is that
Sure.
okay?
Yeah, of course.
From Allie Janisek.
Hi, Allie.
Do you think that quarantine has resulted in a positive experience for you because you can still stay home and give your attention to your students? That's a great question. I actually was thinking about that too, in the sense that, like, getting up, the energy to go to school, get dressed, and stand on your feet all day compared to being able to stay home and essentially be comfy while you teach. Is that helpful for you?
Yeah, it has been. I think it takes away a lot of the pressure that I had put on myself to be a certain way and to achieve a certain energy level in my classes each day. So there's a little bit of easing more into my morning and then trying to get into like a position on my couch that'll work for me. Or if I just can't do it, and let's say I had something lined up like a Zoom session for the day, I don't feel guilty about saying, hey guys, can't do it today. We'll reschedule it for another time or another date, and not having to worry about sub plans, not having to worry about getting a sub, not having to worry about what this might mean, for my image, because I don't know if students realize it, but teachers, especially teachers like me, we do not like to miss school often, and I don't ever want to give the impression to my students that I'm not working as hard as I possibly can for them. So I definitely have appreciated having added sleep. That's tremendous. Sure. I don't even know what to do with myself that I'm waking up at 6 a.m. is like,
yeah,
I'm living in the lap of luxury here. But I still normally start crack-a-lacking with my day fairly early, and I'm doing some phone check-ins with some of my students that have issues with scheduling. So I'm still active, but in a very non-stressful, non-guilt-laden environment. So that portion has been beneficial for me, definitely. Ms. Masonette, are there any other questions that came up? Oh, you're on mute.
Sorry, I muted myself because someone decided to mow their lawn. I'm not really sure what's happening. Can you hear that?
A little bit in the background, yeah.
So I might be moving inside in a second, but no, that was the last question for now. And thank you, Allie, and continue on.
So with the transplant, like Ms. Masonette was saying, obviously the best case scenario is someone in your family, but part of the added complication for me is that I don't get along with my family. I have been estranged from my brother for going on 2 years now. And even though I'm in contact very limited with my mother and father, there's a whole bunch of issues of why I would never ask them for a donation. In fact, I haven't spoken about my disease in over 5 years with them because I don't want them knowing about this aspect of my life. So I don't have that option to rely on family, but that's my choice. It's not that the option doesn't exist. It's just my choice. So my husband has said that he would donate. So that would be the next step for us, is to see if he's a match. And my husband is the universal donating blood type. He's type O.
Ooh.
So
Oh,
that
did
is.
you say it? Don't say
What?
it. Don't say
I
it.
said, oh, I said O already.
Oh, you
Oh,
did? Okay. I was going to say, who knows what the universal blood type is? Okay, keep going.
And so that's, highly optimistic. But even if for some reason he's not a match, because there are some other factors that you have to take into account, there's also the psychological readiness of both patients to deal with the ramifications of transplant. If for some reason he weren't a match for me, he can still donate and put it into a live donor bank. It's like an exchange program. And then that kidney, his, can go to someone else in the country, and then I could receive a match. And that would really expedite the process for me in terms of transplant. Until transplant happens, dialysis is very much in my near future. And so I have two options. The first option is traditional dialysis, where I would go to a center, and that would be about 3 to 4 times a week for 4 hours at a time. And then the other option is what some younger patients have done, is at the at-home treatment. And the at-home treatment, because of the type, it's more of a hydrotherapy. It's shooting water through the stomach. You have to actually get tested if you're capable of having that type of treatment. Your living situation has to have enough room to house the medical equipment that's necessary. But because I think the machines are a little bit less intense in terms of strength, I would have to do this type of dialysis treatment every day for an 8-hour cycle. So you just have to think about, you have to think about how much your life will alter because of your dependency, that you're connected to a machine. And it's not like I can, tuck the device into my pocket and like scootily do around town. This is something that's going to completely limit my mobility and what my normal day would look like. And my doctor doesn't even know if I'm eligible for the at-home treatment, which honestly sounds like it would be more ideal, because you could potentially do it when you sleep at night, but you all who know me know that I do not sleep for 8 hours. So he said, because the cysts are so large on my kidneys, and my kidneys are actually twice the size that they should be. So he says that my stomach probably isn't even large enough to house the fluid that would be filtered through my stomach for the process. And so this leads to another issue with my disease, is that because my kidneys are so large, it pushes out on my stomach. And so it makes me look heavier in that area than I may necessarily be. And just little labanza, as we say, right? The Italians say. So whenever I'm feeling fat, I'm like, oh, it's not the 16 cheeseburgers and French fries I ate. It's because my kidneys are twice the size. So I try and use humor to deal with the reality of it. But this is all connected to that weight loss is a little bit more difficult for me than it would be for the average person. And sometimes, even if I'm doing everything that I should diet-wise and fitness-wise, it's just the nature of these organs is that they're much larger than they should be. Yeah. And
it's interesting that you should mention that, because, some people might listen to that and think like, oh, who cares about your waist size? You have, a disorder going on, like blah, blah. But that's true. I mean, and why wouldn't you? We in medical interventions, we followed a patient through her cancer journey. And, one of the things that always came up for her when it was like, how are you feeling, or what's, bothering you the most during your treatment, was the hair loss. She was so terrified to lose her hair because of the way she was going to look. And that's the reality of it. There's certain things about ourselves that make us feel good, that make us happy. And, when it's one thing that may seem, lame to someone else, but that's what's important to you, or that's what makes you, feel good, or that's your gauge, then no one can judge that. And that's the kind of thing that you're like, oh, you know, I mean, I get it.
Yeah, I mean, it probably is something that occurs more to women.
Sure.
You know, and it's like it's also linked to like if you're fit everywhere else, and then you've got this one part of your body, right, that it protrudes a little bit on a woman. Unfortunately, a woman of a certain age, then it provokes the next question from people, and I swear this happened to me a lot, is, oh, you're pregnant, right? And I'm like,
Right?
wow, I've got something I'd really love to tell you right now.
Exactly.
And, you know,
Yes.
so that's a whole other conversation. And when I had even thought about children, having children in my past, when I was diagnosed with this disease, I was told that I'm at super high risk for pregnancy because the pregnancy could make me go into renal failure. And it was one of the factors that helped me determine that I was not going to have children. Just one of them. There were a few others, but
Sure.
it was one of them.
Oh boy. This is heavy stuff, Miss McNeila, but I'm just so thankful that you're sharing. And I was, you know, thinking about how many kids would show up to this live session, just because it's a Wednesday and I got to make it optional. And, you know, 10 o'clock is a very early time for teenagers in quarantine. So I wasn't too optimistic about how many kids would come. This is the perfect amount, though, because I think any more than this, it could have been overwhelming for you or for everyone trying to listen. So this is perfect because it is recording, and my entire class is required to watch it eventually for their assignment. So I think that they're all going to be, they're going to learn a lot and hopefully have a little bit of, you know, empathy. Is that the right word? For everything that's going on. I mean, this is intense. Friends, I would love to spend the last few minutes hearing from you. Any questions that you can think of. Think about your current activity that you're working on, 421 with Diana Smith, and the type of renal failure that Diana Smith has. Oh, did I just give up the answer? I think you guys all knew that she had renal failure. They've been detectives, Ms. McNeila. They've been trying to figure out what Diana Smith has, but I think they already knew. And today their assignment was to get some of these diagnostic tests back and from Diana and see, you know, maybe if that helps them diagnose her condition. And then moving forward, offering some advice to Diana about the treatment that she can possibly undergo. And they will be watching a video between today and tomorrow about the different types of dialysis, whether it's at the hospital or the at-home treatment and the different types of dialysis that are out there for different patients. So with all of that in mind, you guys, does anyone have any questions for Ms. McNeila about, you know, her prognosis moving forward, anything that she mentioned, life in general, her favorite movie? Is anyone awake on this Zoom?
I don't know. It's hard to tell.
I mean, it's par for the course, right? Is this what happens in some of your Zooms?
True. I'm looking at these names. They're like on point. I don't know why they're quiet.
I
Moira's
feel you.
never quiet. What's going on? I'm shocked. I'm shocked she's not saying something.
I mean, they could have pulled the slip on us, you know, put the name up, mute yourself, and go away.
I'm getting some strong indications now.
Yeah.
I would never, Miss McNeila.
Oh my gosh,
Moira. Moira, you should be like, I don't know, muttering something under your breath right now.
I'm not.
And yeah, come on, you're my sarcastic touchstone. You know, I rely on you for that biting wit, that keen sense of commenting on reality.
The fiercest eye roll I know.
She's so good. She's so good. You know, it's something else that I didn't mention, and maybe in your study of renal function, you did talk about it, is that if there are any physical signs on the body related to renal
Oh, yeah.
failure. It's
Great.
the bloating of and the swelling of around the appendages, so especially with the ankles and the legs. And then also my nephrologist always checks my wrist, but
Mhm.
he constantly looks at my ankles and he checks my calves to make sure that everything is okay. And when I do go in for my nephrology appointments, like I said, I am significantly younger than the people that I see in the office. And so there's also sort of like this psychological mind game that goes on when I see their age, where I see how infirm they are, where I see the tremendous swelling in their bodies. And I think, is this my future? Like, is this what it's
Right.
going to be like for me?
Right.
Or will, technology change? Will the resilience in myself be different, that I will have a different type of life? But there's
Yeah.
constant emotional and spiritual questions and misalignment that happen because of this disease.
Well, and it's interesting that you should mention, the trajectory of just, renal treatment in general, as with any, medical treatment, that everything advances, beyond what we could ever imagine, right? I mean, 50 years ago, you talk about end-stage renal failure, your options were transplant. That's it. There was no such thing as dialysis. We didn't have machines that could filter your blood for you. Same thing with heart transplant and everything else. The things that we can do now, that we couldn't 50 years ago or even 10 years ago, should be, I always, try to find that as a light for any patient that, that maybe has a little bit of time to give to their disorder, where that there could be advancements. And, we just have to trust in the scientists and the physicians that are out there working really, really, really hard to try to find, better cures, faster cures for people. And that'll do it. Who knows, right? They're 3D printing parts of the heart now. So, you just never know. Maybe you're going to be our first 3D printed kidney.
I'll take it.
There's
I'll for sure take it.
Right? There's another question in the chat. Hey, Miss McNeila, before I get to that question, how cool would it be if one of these medical intervention students were the ones that developed, some cure for you? Ugh, I can just see it happening. They're super bright.
That would be great. And I would ask for a discount.
Oh, perfect. Yes. I'm sure they would be a pro bono job.
Because that's another issue, is finances.
Oh my gosh, can't even get into that, right? Oh my word. Okay, the question in the chat is from Marley Johnson. And she says,
Marley.
When you feel too tired to go to school, do you still push yourself to work out and try to stay active?
Oh, the days that I'm too tired to go to school, I could never work out. I'm talking about a fatigue that I have difficulty even rolling over in my bed, that I have to actually pull on the bed sheets to give me the momentum to roll over. But because I'm sleeping more and because I get to ease more into my day now with this situation, one of the benefits is my energy has been a bit better, and I've been trying to go for walks every day. And, obviously that's going to help with mental well-being, but
Of course.
I've sort of started this new motivation to try and get my fitness to a really solid place, because my function is dropping so significantly that I want to be in the best health I can be for the inevitability of transplant. But just a week ago, I had a day on a Friday where I could not move. And it was the greatest achievement of the day to move from the bed to the couch. That's the level of how much my body hurts. That, yeah, it's like I've turned into a shell of who I normally am.
Yeah. Thanks for your question, Marley. Anyone else with questions for Miss McNeila? I don't want to hog her whole day. I think she said she had another meeting at 11, right?
Yeah, I'm gonna do a Zoom, but it's not until 11:30.
Okay.
Optional.
Gotcha. Yeah, gotta have those optional things. Okay, we are gonna wrap things up unless there's any last minute questions. And I appreciate all of you that took the time to at least turn on your Zoom. Whether or not you're actually here is in question. But thank you for those of you that chimed in and took the time to listen to Ms. McNeela today. I hope you have a deeper understanding of ESRD and what's going on in Ms. McNeela's life personally, and a deeper appreciation for how hard she's working, and in the face of, this crummy disease. And we'll be talking more about all of this moving into your next activity. I will say and ask now while Ms. McNeela is here, that if you have any questions for Ms. McNeela, coming forward about her condition, I think that she would be happy to entertain emails.
Sure.
I do say that and just want to make sure that's okay, because this video will go out to all of my students. So if they hear that at the end and they get to ask you a question, you might get a handful from that.
Sure, sure. That's fine. I'd be happy to.
Great. Well, thank you so much. I would love for you all to thank our speaker if you are still around. Oh, wait.
Thank you.
Oh, there was, Makana just said in the chat, this isn't a question, but thank you for sharing your story with us.
You're welcome. I hope you're doing well.
Awesome. All right. Thank our speaker and thank you, Ms. McNeela. And I will talk to you all very soon. Have a great day.
Bye. Thank you.
Thank you.
Thank
Bye-bye.
you.
Thank you, Ms. McNeela.